Hi, everyone. Thanks so much for joining us. My name is Selena Ramsey. I'm from the Staten Island Performing Provider System, and I'm here with my colleague, Sadia, who will introduce herself in just a few minutes. We are so excited to have you guys with us today as we move into our second webinar on the social determinants of health. Today, we're going to be focused on the housing instability and insecurities as a social determinant of health, and then some local housing resources that are available across Staten Island. Just a few notes on how the webinar will flow today is that we are going to be muting everybody, so you're probably already muted. We're not going to be unmuting anyone except the presenters, so if you have questions, please go ahead and type them in the chat box as soon as they come up in your mind. We'll be able to address them towards the end of the presentation, and we'll direct them to the appropriate presenter so that they can make sure to answer your questions correctly. This presentation is going to be recorded, and we'll have it posted up live on our website within the next week. So right now we're just creating a place on the website where the webinars will live. And if you joined us last time, we spoke about food insecurity and the different food resources that are available on Staten Island. So today we have a little bit more to talk about with social determinants of health, how people find themselves in housing crisis in the first place, and then we have 3 really great presentations on the resources that are available for homeless prevention, and then for people who are homeless and seeking shelter. So let's just get started. Sadia, would you mind introducing yourself?
Sure. Hi, everyone. This is Sadia Chaudhary. I'm the Director of Ambulatory Care Initiatives at Staten Island PPS. And most of you guys may already know me as we have been working together in implementing this program effective July of this year. And so looking forward to this webinar. Thank you.
Great. Okay. So we're going to get started. We know that healthcare and our physicalness only accounts for part of our ability to stay well. What you might not know is that although the United States spends the most out of any developed nation in the world on health care, we spend the least on social care. And we're really starting to see that the burden impact society members, because we know that at least 58% of people are dealing with a chronic illness. So the thought is that if we reverse that trend and we spend money addressing people's social and lifestyle needs, we would be able to have a much healthier community and population in the United States. So here's our agenda for today. We're going to be looking at an introduction to the Staten Island PPS, what the new social determinant of health app looks like. Sadia is going to talk about the project, the initiative that's happening on Staten Island, and then we'll hear from some of our community partners, Canva and Project Hospitality, and then we're going to wrap up with just a couple of notes on the other resources that are available that are able to help shelter people across New York City. So I'm going to begin. Again, this is Selena Ramsey from the Staten Island PPS. We are a network of 75 different partners in health and social services. We're called the PPS. It's called Performing Provider System. And what that is, it's really a network, and we are working on Medicaid transformation. New York is the 13th state in the country to submit a waiver to Medicaid, CMS, and ask for money to be reinvested throughout the state in hopes of transforming the way that we provide healthcare and services across New York. So the project has been going on since 2015, and it's called DISRIP. DISRIP stands for Delivery System Reform Incentivized Payment Program. And what we're really doing is moving the care into the community. So the overall goal of the 5 years is to reduce avoidable hospitalizations by 25%. While strengthening the care that providers in the community have. So people don't overuse the emergency department or the hospital, but they're better equipped to be taken care of where they're at locally in the community by primary care, by their behavioral health providers, and by social services. Staten Island PPS has already invested over $130 million over the last 4 years in this district transformation, our projects focus on the Medicaid and uninsured populations. And what we're really doing is looking to set up value-based care. So in the past, insurance companies and the government and our tax dollars would pay per service. So if you had 5 MRIs for the same thing and nobody in the background was talking about and sharing that information, and as a consumer you weren't empowered to let your provider know, hey, I already went to this MRI, they would pay 5 times for 5 separate MRIs. In this transition to value-based care, we're paying for quality. So we're paying for a more holistic view and a holistic approach to somebody's overall health and wellness. That's really our big long-term goal at the Staten Island PPS. Something that makes us remarkable, I think, in comparison to the other 24 PPSs across New York State, is that we're using data to drive every initiative that we have. So if you see on the screen right now, we have on the top left-hand corner in that box is how we started looking at data and health information and health disparities. It's called hotspotting. So any of the darker colors, the reds and oranges, are where the higher concentration of people live with this health disparity, with diabetes. We were able to overlay race, ethnicity, gender, nation of origin to get sort of a clear picture of what's happening to people. You can kind of imagine the environmental issues, the access to transportation and food in those areas that might also contribute to diabetes. But now we're also able to overlay this social determinant of health information that we're collecting through this project on top of people's population health information. So the bottom left-hand and the bottom right-hand maps, every single dot that you see is actually somebody's life. And if I hover over that map, I'll be able to pull up their entire medical history, any medications that they're on, information about them, their demographic information, plus whether they're experiencing any social or lifestyle issues that might also be impacting. And here in this data map, we're looking at pediatric asthma. So we might also learn things about the client that would paint a more holistic view of them and help us, help the doctor, help the provider, help the organizations invest in addressing those issues so we can help people take better care of themselves as a whole. So the PPS, as I mentioned before, we have a lot of different initiatives and projects that we're overseeing with our many partners across the island. These are some of the ways that we've already invested in social determinants of health. So far, we've spent over $7 million making sure that our partners have access to some social service projects that weren't available on Staten Island in the past. So this is just a quick snapshot of some of the things we've been able to accomplish over the last few years that touch those different social determinant of health categories. I'm going to introduce Sadia. She's going to give you a little bit of an oversight into the social determinant of health project that she recently launched with some of our partners.
Thank you, Selena. As Selena alluded to, we just recently launched the program. We actually closed the first quarter at the end of September. So in July, we were able to launch the program with 19 PPS partners, which included the 2 main hospitals in the island, primary care practices. We have a lot of community-based organizations and behavioral health partners who are participating in this project as well. And initially, the program requirements have been to use the tool, the SDOH tool that we have developed using the evidence-based questionnaire, and have developed the in-house grown app to identify barriers as we assess the clients. And then once the navigators identify the barriers, the expectation is for them to connect them to appropriate resources, which is what we have been focusing on. So the first was the food webinar, and today is the housing webinar. So we're going to talk more about resources. We also expected the navigators to connect clients to PCP if they don't have one, or if they have a PCP but haven't gone to a see the medical doctor in the past 12 months than to make an appointment for them. And a very important piece that we as a PPS have been emphasizing is to close the referrals. So it's not enough to just connect the clients to resources. It's important to follow up with the client or with the organization that the referral is being made to, that the client actually receive the service. So that's what we have made it a requirement for organizations to close the referrals within 4 weeks of making the referrals. Next slide. So just to give some, overview of the data for the first quarter of the launch, which is from July 1st to September 30th, 6,095 unique surveys for SDOH have been done by all these 19 partners, which is great. And they have identified more than 11,000 SDOH factors. However, the referral rate have not been that well, but then again, we understand there's a learning curve. So moving forward, we expect the partners to kind of ramp that up a little bit more. But if you can see the numbers in terms of which factors have more prevalence in the island, food definitely is the highest one, which had 35.4% prevalence, and that was our first webinar. Housing, though it's 8.4%, I'm sure the ones that do need the services, is quite urgent. So that's why we wanted to kind of focus on that. And you can see down the chart, which ones have, what is the order in terms of the prevalence of these factors. One good thing is also that our primary care practices that are participating in this project have these questionnaires in the app integrated in the EMR as well. And moving forward, we should be able to send the CBO agencies that the navigators are making the referrals to get some kind of email notifications, so they will know which clients have been referred to them, and they can follow up accordingly. And these are some screenshots from the app itself, just showing what are some SDOH factors that we are focusing on. There is a consent piece by the client that is very important to capture. So we know the client is giving us the referral, giving us the consent to make referrals once the navigators identify a needed factor. And then some, screenshots on the food or housing, and the similar goes for all the other factors as well. If the client identifies a factor as being a yes or urgent, then there are triggers to connect them to appropriate resources. And the last screenshot on the right is what the client can receive as a text message or an email in their phone, as to what the outcome for the survey. They can know what the referral has been made to, and they can follow up accordingly as well.
Okay. Yeah, so the navigators that are part of this project, and anyone who uses the application, the screening tool, has access to different referral resources. And of course, since we're on Staten Island, this is Staten Island specific resources, but there are so many wonderful databases available online, like the Height site, and other Excel files and resource guides that really encompass the entire city. So these are the resources that our navigators are able to use to make referrals with. They're ever changing. If you're not on our resource or referral list for housing or for any of the other social determinants, please feel free to shoot me an email, and we can certainly share these referral lists with you if you're interested. So just write in the chat box, and we'll make sure to get your email and send those over to you. So before we get started talking about the resources that are available out there for housing, I just wanted to kind of level set a little bit. And we've been saying, social determinants of health, and I realized that even on the first webinar when we were talking about food, that we really didn't do an in-depth analysis of what the social determinants of health even are, and why are people being impacted by them. So the World Health Organization has a great definition of social determinants, that they are the circumstances in which people are born, grow up, live, work, and age, and the systems put in place to deal with illness. Those circumstances are shaped by a wider set of forces, and this is kind of the conversation that we want to have is how do we move this upstream? So upstream, in order to impact the social determinants of health that are happening to people on the street level, we need to make sure that we can advocate for things that are happening in economics and social policies and politics that shape what happens to people by these systems that they're living in. And now when we're speaking about housing today, access to safe, quality, and affordable housing, those three key items, having access to safe, to quality, and to affordable housing, it's probably the most basic and powerful social determinant of health. I love this quote by Dr. Aiton that says, "There's a lot of information in an address. It tells me about your income, your education, the access to healthcare and employment opportunities you've had, and I can pretty much predict your life expectancy by where you live." And that's such a powerful statement. And people coming from this on both sides, people in power, people with privilege, it's necessary to recognize that your zip code really does dictate a lot of the things that you'd be able to have access to in your life and impacts your entire social and well-being in healthcare. So the big question is, can we afford to neglect social determinants of health? I told you the statistic already about how many people have chronic illness. About 58% of people living in this country are dealing with a chronic illness. A lot of that is contributed to their ability to survive in the world that we live in. So that means access to food, access to basic needs like shelter, having employment or having a job that pays well that you can afford your basic needs. I hope you are surprised by this pie chart that shows that, you know, our physical well-being only accounts for a very small fraction of our ability to stay well in this whole world. Actually, on Staten Island, we surveyed patients of ours that had a chronic illness, and over 80% of them have reported experiencing a social determinant of health. And this is pretty consistent with the data that Sadia just shared with us. About every client that we survey, that we screen for social determinants, they have at least 2 social needs impacting their ability to get and stay healthy. This is a big problem. So how is homelessness a problem? Here are some pretty startling statistics. This was taken from the website of the coalition, the Homelessness Coalition of New York. So right now, currently in the last few years, we're at the highest levels of homelessness since the 1930s. That's pretty scary, and a lot of these homeless people are children. So homeless people either access the shelter system across New York City. Unfortunately, at the moment, there is no Staten Island, New York City-based shelter system. I'm sure you've heard the news that 2 shelters are coming to the island. It's unclear when those will be up and running. But right now, you know, there's a majority of people accessing the shelter system, and then there's a lot of people who are unsheltered and homeless living in the street, in the subway, and other public spaces. There really isn't an accurate way to measure those people that are transient, that are outside of the shelter system. A large majority of people who live on the street are dealing with a mental illness or other severe health problems. And of course, people who are African American or Latino are disproportionately affected by homelessness. And that's the same truth with all social determinants of health. So people who are not white have less access to those social and health services that they need. So why are people dealing with housing insecurity? Well, it's pretty complicated. The things that we've learned and we've researched on, a lot of it has to do with economics. So whether people have access to stable jobs that pay more than a minimum wage. Something that I learned from the food webinar that we did last time is that in order to live on Staten Island, you need to make over $5,000 a month just to afford basic needs with no cushion. So basic needs is rent, food, healthcare, clothing, right, childcare. So those are basic needs. That seems like it's a pretty high number, and especially if you're getting paid a minimum wage job, you can't make ends meet, and public assistance just might not be enough for you. Some people face eviction, are homeless or housing insecure because they have hazardous housing conditions. There's also poverty affecting people, domestic violence, and then people with housing issues also deal with other social determinant of health factors. Okay, so that just ends the portion that the Staten Island PPS is going to be presenting on. If you have any questions on anything that I just covered, please feel free to enter it over here into the chat box. Let's see. A lot of people are asking, just a note, a lot of people are asking to be made the presenter. I don't know if that's just a glitch or something in the system, but we are not going, just for new people who joined, we're not going to be unmuting anybody, and we'll be saving questions and answers for the end of the presentation. If you have a question for any of the presenters, please enter it into the chat box. Okay, so our first presentation, I'm going to pass the mic over to Grace Ruiz, and Grace is from Canva's home-based program, and they are primarily a homelessness prevention program. Can't wait to hear from you. Grace, you can take it away.
I think everybody hears me now. Hi, good afternoon, everyone. My name is Ms. Grace Ruiz. Thank you so much for the intro. SIPP. Yep, as mentioned, I'm the program manager for outreach and marketing for Canva Homebase. And thank you, SIPPS, for this opportunity. So I'm just going to jump right in then to the presentation. So I'm going to discuss the overview of Canva. So next slide. Canva is a nonprofit agency that provides services that connect people with opportunities to enhance their quality of life. We serve now more than 60,000 individuals and families, where Canva provides access to resources and supports the community needs then to thrive. So we serve more than 60,000 individuals and families, as I mentioned. And this may be for people who are homeless, at risk of homelessness, immigrants and refugees, entrepreneurs, and other groups working to become self-sufficient. Next slide. So now the program I work for, Homebase, is the homelessness prevention program with 26 locations citywide, targeting services to over 28,000 at-risk households annually. Homebase serves all the neighborhoods and are organized by zip codes. Canva, however, works in the Staten Island, and we serve 25 zip codes in Brooklyn. But we have 2 offices in Staten Island. We serve residents who reside in the communities that are at critical risk for shelter entry. And fun fact, last year, all the home bases combined, all the home base offices citywide, served over 30,000 families and individuals. So that was a good call on us. So next slide, please. Who do we help? We help families with minor children and adult family, single adult households with children under the age of 18, experiencing a housing crisis or instability to ensure that they don't have shelter entry. We also assist families with minor children and adult family, single adult households that are moving into permanent housing after leaving the shelter. We want clients to remain stabilized in their homes and not return to the shelter, aftercare services. Next slide. So how can someone access a home-based office? They can call the office that directly corresponds with the zip code on the DHS website. They can come in as a walk-in, or they can call 311, or they can send a referral to their point of contact at the office. I'm going to go into further more on how Canva Homebase receives referrals later in this presentation. And here on slide 6, I provided with you all the home-based offices that are in all 5 boroughs. And in the next slide, as you can see, Canva Home Base, we serve the 25 zip codes I mentioned in Brooklyn, and we serve the entire borough of Staten Island. So we have 2 offices, and these are the, next slide, Canva Home Base offices that are in Brooklyn, up above in the blue, the 3, and the ones in Staten Island, these are the 2 mentioned, 120 Stuyvesant Place and 209 Bay Street. Next slide. So once the clients they go to the office, and this is what some of the services they might entail and might look like. Community prevention, which is composed of the housing assistance and advice, landlord-tenant mediation, social service, and legal referrals. This may be for someone who's currently housed and just at risk of eviction. Shelter, diversion, and housing assistance, that now in Staten Island, we have it a little different because we have an enhanced home-based office, which I will discuss further, and it's to assist families with minor children to divert them from going into shelter. And the community support / aftercare services when tenants are exiting the shelter and they're in their new apartment, and it just so happens to be in Staten Island. We want to be the community introduction, support, and so that the tenants are familiar with their lease, subsidies, and renewing their subsidy as well. A lot of these services that we provide may help with financial assistance for rental arrears and utility arrears, which is important to keep in mind that, next slide. Next slide, thanks. Homebase is the payer of last resort, the one previously, sorry, thanks. So like I mentioned in the previous slide, we may help with some financial assistance for the rental arrears and utility arrears, which is why Homebase is the payer of last resort. Clients should seek all other resources prior to coming to Homebase. For example, we're going to ask if the client applied for public assistance. Did they get full public assistance from HRA? Did they apply for a one-shot deal? If they got approved for the full amount, they wouldn't need assistance then from Homebase. The end goal is for the client to become self-sufficient and gain financial and housing stability. Going to go to the next slide, please. So stability with rental arrears, utility arrears, and possibly storage fees. That's what financial stability looks like for us, and housing stability, like support with the subsidy applications, renewals, transfers, and advocacy for benefits. This goes further into how we want to support tenants with what Homebase does. Next slide, please. So case management plans is a couple of the services we provide. Employment through our Forward Focus program, only if they are a home-based client. So if they aren't a home-based client, they're interested in employment services or coaching, then through our Forward Focus program, they could look into that then as well. Financial literacy training is mandatory if they do receive financial assistance. And referrals to our Canva in-house program. So Canva as an agency, we have several programs like legal services, after school programs for kids. So within these programs, through our very own in-house referrals, we could do then that as well. In addition, I will discuss this a little further, we also have a home-based referral tool that if any organization feels that they have a client or family that might be at risk for homelessness and facing eviction, we could provide you then with that home-based referral tool, and I'll discuss that further within the presentation. So next slide, please. So this is just an overview of the services that Homebase provides. Just a little bit of what I briefly mentioned. Great, and next slide. So now in Staten Island, like I mentioned earlier, we have 2 offices. 120 assists with families with minor children and single adult households, adult family households, meaning everybody's over the age of 18. 209 Bay Street is the only one in Staten Island that provides an extension of these services. It's only for families with minor children, so meaning the children are under the age of 18 and that they are at imminent risk for entering the shelter for Staten Island residents. I call it a stop before the PATH Center. Next slide. 209, that's the beautiful office right there. They, like I mentioned, only serves families with minor children that are on the verge for entering the shelter. This is the only office also that has a housing specialist because They are actively trying to assist with the subsidy or voucher that the tenant might have with the family to help them look for an apartment within Staten Island while they're trying to figure out what's going on with their case. But in both offices, we do have HRA coordinators that help with the public assistance status and start the one-shot deal application. The Camden Hands home-based office, like I mentioned, only helps families with minor children in Staten Island, and they work actively to find housing because we have a housing specialist in this office because the family may be determined eligible since shelter may have been their only resort. So if shelter entry was their only resort for the family with minor children, we suggest that they should go to the Camden Hands home-based office. Other than that, the services are pretty consistent with both offices, and they also change. So we'll gladly update you all and SIPP as well, PPS, when that occurs. Next slide, please. So here's a further scope on the services that are within all the offices. Actually, you could go to the next slide after that. Thanks. So it's workshops for employment or financial education, landlord-tenant mediation, linkages to all the community services like legal services, hospitals, schools, maybe some that we can start with you all. And HRA coordinators, like I mentioned, are in all our Staten Island offices. They can start with the one-shot deal, review the verification of benefits, and communicate with the job center staff. They just have to come into the office and see if they're eligible for services. Next slide, please. What does that look like? Home-based structure. So when someone comes into office and see if they're eligible for services, and come in as a walk-in or an appointment. We'll determine if they're eligible, do an intake pre-screen, and assess them for home-based services. Second meeting or appointment, they might meet with the case manager if they haven't already, and we'll determine a service plan based on the eligibility or what they were determined at intake. And other appointments might include follow-up appointments or missing documents, or depending on where they are in the service level, which I'll go into, we might have further appointments with the clients. But this is what the general structure then looks like. Next slide, please. And in addition, some further notes is that home-based, we offer walk-in appointments. It's strongly recommended that all clients call in advance to schedule a time for an appointment. I always say the best advocate for you is yourself. So that's why we tell tenants to clients, tenants to be consistent with your case manager. Anything, updates on phones, cell phone numbers, let us know, reach out to us. While on outreach, my team, they do meet people in the community that might be eligible for home-based services. So they do a screening. They'll be able to do a screening right then and there. And if it's urgent, we definitely want to know that. And we could try to see if we could expedite the appointment, especially if like a live marshal's notice, or they informed us of this is an emergency possibly. And we also want to provide community referrals to the clients who may not be eligible for home-based services. So if they were not determined eligible, we definitely want to let them know and let them know about what we could possibly do. Next slide. As I mentioned, while on outreach, this is one of the outreach ways that we conduct outreach. We have a mobile unit that is fully equipped with usually two of my community liaisons go into the highest eviction locations, and they could fully enroll someone that might be in the community, coming outside their apartment buildings, letting them know that we're here and that we want to try to see if they're eligible for home-based services or if they know anyone that might be experiencing a housing crisis. Take a flyer, take some information for anyone in your house or community or building. And I'm going to go into a little further about that, but that's just a little snapshot of the UCAN van. Next slide, please. So once we meet the client, we try to find out if they're eligible for home-based services. So for families with minor children, it's all this is also a case-by-case basis, but this is the main baseline requirement for clients that are coming into our offices. So with families with children, the household must be with children, with anyone under the age of 18. The benefits is must be the income criteria noted below, which must be or below be at or below 200% the federal poverty level. And we do conduct a risk assessment questionnaire provided us by our funders, which is HRA, DHS, Department of Homeless Social Services, that after this questionnaire, they must be determined to be at imminent risk. If they are determined to be at imminent risk for homelessness, if it wasn't for home-based assistance. Clients should always be referred to home-based to complete this assessment, just to determine eligibility. Again, this is also a case-by-case basis, so things may change, and we could definitely inform the providers or the referrer if what may have occurred, or directly speak to the client as well. Next slide, please. This is also then the eligibility for adult families. It's pretty similar, just the difference is the AMI, 30% the area median income. And I've been told that I have a couple of minutes left to wrap up. So these are briefly the service levels. Next slide, please. Housing advice and assistance, which if they didn't meet full services, this is where they might receive referrals. Full services, or anyone at risk, at imminent risk, they might be receiving financial assistance from us. And intensive, it's just explaining more significant need with an addition full services. So they'll be getting the full support of full services, but it's just going to be a little more intensive, a little bit more hand-holding. Next slide. Okay, this is just a little bit more with the UCAN Van outreach, liaisons, data-driven targeting. Our program analyst created a machine learning tool to effectively predict the displacement and better target outreach. More information about it, I'll have it towards the end. Next slide. This is how the targeted outreach looks like, and the team has this on their iPads and tablets and phones so that they know where we have to go with the van. Next slide. And this is what they've encountered when they do conduct outreach. Next slide. And this is how the UCAN Van looks like. And we're always looking to partner. So any events you feel that we should be, definitely we'll definitely love to talk further about it. Next slide. And outreach results. We targeted, enrolled 180 families, 61% from the buildings that we conducted outreach were enrolled, and we actually went up, this has changed, 19% compared to last year. So these are the results. Next slide. Further results, which 96% of those households avoided shelter thanks to Canva Home Base, and 4,000 households experiencing a housing crisis were identified as well. These are the overall results for Home Base. Next slide. And these are the highlights for Staten Island. The total number that we assisted with families in Staten Island was 1,096. Average age was 38. The clients were below or at the 200% poverty level. 69% unemployment amongst families we served. 65% were high school educated. 75% were families with minor children. And it was usually it was a minority female who was the head of household. Next slide. So this is just a couple of questions to keep in mind. I'm going to wrap this up if it could give me a little more time. Just when you're making a referral, these are the 6 questions to keep in mind. Eviction notice, any shelter in the past 3 months, have they ever been in shelter, discord with the landlord, does the apartment need repair issues, or any public, do they have public benefits, and are they currently receiving any assistance from the city, state, or federal agency? Next slide. This is, we'll review the referral, contact the client, make sure that we reach out to them consistently, and we'll work together to strategize in order to engage the client to enroll into home base. Next slide. All referrals should be sent to Ms. Hygiene Henry at canva.org. She's a program supervisor for all the home base offices in Canva Home Base. So she receives the referrals for Staten Island and Brooklyn and informs her assessment team, who will reach out to the client. You could see the following as well. They will are the director, VP, and assistant director for Canva Home Base, but the main referral should be sent to Ms. Hygiene Henry. In addition, we also do have a referral tool that was created by the program analyst that if you'd like for access to that, we could definitely share further information about that. You could definitely reach me. So my last slide. The next one, what to bring. So anyone that's coming into the offices should bring IDs for all household members, proof of income, any active public assistance information, bring that in as well. Any award letters for housing related, a copy of the lease, rental assistance vouchers or award letters, rent demands, landlord court documents, eviction letters, and if they have utility arrears, light, gas, and the telephone bills then as well. So next slide. With that being said, thank you so much for this opportunity and for listening. Definitely follow us where the van's going to be in Staten Island or which event, and we'd love to partner with you all as well with the UCAN van. My contact information is here as well, including the program analyst and my vice president. And if there's still time available for questions, I definitely would love to take some questions. If not, you could also reach out to me with the email listed here. Thank you again.
Thanks so much, Grace. That was really wonderful. I love that your team go out into the community to canvass neighborhoods, and then they could see actually where people living with possible needs are, so that that outreach with the UCAN van can be targeted and focused. That's really interesting. We're going to put you back on mute, and then anybody that has a question for Grace, please go ahead and type it into the chat. I saw a couple come through. We'll definitely have time at the end so that Grace can come back on and address those for you. I would like to introduce our next guest speaker, Tisha Diallo from Project Hospitality is going to be talking to us about Project Hospitality's drop-in center and outreach and housing placement programs. They do a lot of exciting stuff. They're on the ground. They know what's happening with the homeless situation on Staten Island. We have a lot to learn from her. So Tisha, we're going to unmute you now and you can take it away. Thanks so much.
Hello, everyone. Good afternoon. Thank you, SIPPS, for this opportunity. We greatly appreciate it. I'm going to start off talking about Project Hospitality's mission, which is, it is a mission of Project Hospitality to reach out to the community members who are hungry, homeless, and otherwise in need in order to work with them to achieve self-sufficiency, because that's the key goal, thereby enhancing the quality of life for our Staten Island community. Project Hospitality seeks to realize its mission both by advocating for those in need and by establishing a comprehensive continuum of care that begins with the provision of food, clothing, shelter, and extends to other services, which include healthcare, mental health, alcohol and substance abuse treatment, HIV care, education, vocational training, legal services, and transitional and permanent housing. Next slide. Next slide. Okay, so I'm going to talk about Project Hospitality Drop-In Center. A drop-in center in New York City Department of Homeless Services operates 5 drop-in centers throughout the 5 boroughs. The drop-in center is really geared for anyone that find themselves that's homeless for that day, whether they was evicted or whether they had a fight with their spouse or significant other, or if they're just looking for services. So they will walk in. The Project Hospitality Drop-In Center provides hot meals, showers, laundry facility, clothing, case management, medical care, psychiatric services, a recreational space, and employment referrals and linkages to other services. Our staff immediately assess the needs and work with individuals towards permanently housed. And it's located at 25 Central Avenue, right across the street from the new Supreme Court. It's operated 24 hours a day, 7 days a week. And, the phone number is there, 718-720-0079. And anyone can call, anyone can walk in there, whether they are single adults, whether they're families, whether they're youth, they can come in there and get information and get led to the right direction. Next slide. Single adults in need of shelter can always access our drop-in center. Like I just said, anyone can come in there, but we really focus on single adults. Self-referrals means that they can walk in. External referrals means that they're coming in with a referral. We may get a phone call, someone wanting to refer someone just wanting to ask a question. The drop-in center will refer families. If a family walk in, we'll refer them to PATH. and to any other New York City adult intake center to ensure their needs are met. Next slide. Outreach. I'm the program director for outreach and housing placement, and we work collaboratively with the drop-in center, which is our hub, is where we bring people. So our department is the first point of contact when a person becomes homeless, and that's via in the street, or even if they walk into the drop-in center, they will meet my staff. I have teams of 2 that will canvass all the areas on Staten Island, such as the ferry terminal, which everybody knows that there are a lot of homeless individuals that are located in the ferry terminal. And then the parks, we have Tompkins Park, we have Tappan Park, we have the bus depot at night where people stay, and my team will go there. We also respond to 311 calls and community calls. So when my team come into contact and engage the individuals, the first thing they'll do is just to assess them and determine their immediate needs. Some of them just want, someone to talk to find out information on what their next steps would be, if they had an argument or if they had a fight with their significant others. Others are coming in because they really have nowhere else to stay, so we will guide them and bring them to our drop-in center or place them into our stabilization or safe haven. Next slide. Okay, so frequently asked questions. In collaboration with Department of Homeless Services, outreach programs providers know helping someone off the street can take hundreds of contacts, and it can take a long time to really get someone to trust you that's been on that street for so long when everything else has failed them in regards to the systems, the city, the government. When everyone else has failed them and all they have is us, they have to build that trust, so it takes some time. However, we are persistent, we're compassionate, we understand, we won't stop, until they receive services, until they get what they want. So we work really, really hard with them to understanding what their needs are, because again, we work for them and trying to get them to come up off the street. So what should I do if I see an individual group that appear to be street homeless? What we say is that you can call 311. 311 is an app that was created through the mayor's initiative so that people that are out there in the community can do something right now. They can utilize that 311 app and let us know that someone's out there that needs assistance. Once they, what happens when they call that 311 app, we get notified. We have a database, we have apps on our phone, we have it on our tablet, we have it on our computer. We get alerted, we find out that someone has seen someone that appears to be homeless, they give us a description, we go out to that location, we have to be at that location within an hour of that call coming in, or that information being provided into that app. We only have 1 hour. Once we get there, we have to respond in the app, we have to respond to what we've done, right? So what services are offered to street homelesses? Once our team assess that individual, find out, we'll do an assessment, find out what the client needs, then we'll realize whether or not they'll go to our stabilization program, if they'll go to our church bed, if they'll go to a respite bed, if they'll go to the drop-in, or if they'll be referred off of Staten Island. What happens if someone declines help, which is often. Clients, again, I mentioned that it takes 100 engagements, over 100 engagements. So people do just decline. They don't want any help. They don't want any help. But the day that they're ready, we have to be ready. And so that's really, really important to make sure that we're always ready. And my team is always ready when they engage these individuals, because the day could be the day that they're ready to come up off those streets, and we have to have a plan. And that's why we work collaboratively with the drop-in center, because that would be the first point that we would take someone just to assess them and figure out what it is that we can do and where we have vacancies and what beds are open. Next slide. Street homeless sites. What is the difference between encampments, pop-up, and hotspots? There are differences, right? An encampment means that someone built a shelter. That means that someone built a structure that you can't move. We had an individual that built a house along Snug Harbor. And this house, it took 2 days for us to remove it, and that's how firm and that this structure was. They built a home because this is all they knew, for their home was that the structure that they built, right? A pop-up is someone that you see on the corner, maybe, on Richmond Terrace or Vanderbilt, you see someone just hanging out there, a group of people hanging out there, and every now and then you may see them. That's a pop-up. A hotspot is considered a location where they're really, really going to hang out at, which we had, I can name one, which was Tompkinsville Park, was a hotspot. It was where just everyone was just hanging out there because everything was in that area just was accessible. Staten Island Ferry is a hotspot because they can't build encampments, but they sleep there. Next slide. So according to the Coalition for the Homeless, right, in recent years, and I believe that this was mentioned earlier, that, the homelessness has not been this large since 1930, the Great Depression, which is kind of sad. Working, with these individuals and seeing it firsthand to know the population that we serve is underserved. This is not enough, for the clients to make it towards self-sufficiency. And in this picture here, you see this is a hotspot. This is right outside the ferry terminal. This is every single night. This is not a picture that we took for a prop. This is every single night. This is what my team go out to see. They engage these individuals. These individuals will say yes or they'll say no. And we'll just continue to work with them to get them from leaving this space. But right now, they call this home, unfortunately. Next slide. The outreach and housing placement team often are contacted by the community, so we get community calls. People internally call from the agency, from other agencies. They called the mayor's office, Debbie Rowe's office. We get phone calls from everyone, and we do record those calls and we do follow up on those calls. And this is where we begin to canvass. So from those phone calls, those 311 calls, community calls, we gauge areas that we can go to because this is where people have seen people at, and we haven't seen them. So we'll go there and we'll continue to canvass those areas, continue to try to engage those individuals. A lot of times we arrive to locations and people are just not there. You may see their belongings. So that lets us know that someone is present, but they're not present at that moment, and we'll continue to go to that location so that we can see if we can engage those individuals to get them out the street. Right? So we conduct a canvassing on the whole entire borough. We have a team of 21 staff. We operate 24 hours a day. We have 2 to a team, so there's never one person going out to engage anyone. It's always 2. Sometimes we try strategies. We're sending out different teams to engage with individuals that we know that are at a location that's out there in the street, and they may not want to go with the morning team. So maybe the evening team will come in and speak to those individuals, and maybe they will go. Or maybe the overnight team, they go speak to them, and they may come off the street and accept some services. So we try any kind of way to get to engage the individuals and to get them off of the street into something more permanent. Next slide. The outreach hours stabilization program, we respond to the call and engage the client in the community. The individuals will be assessed. So again, I said that we have a stabilization bed program, which is in an undisclosed location on Staten Island, where we bring individuals when we engage them in the street and they're ready to come in for services. We'll place them into the location so that they can stabilize. And then this program was developed so that they can come up off the street and realize and try to figure out what it is that they want to do. Their location, is temporary. It's not permanent. And once we gauge and assess that individual and find out what their needs are, so let's just say that individual needed to have their medication managed, then we would send them to our safe havens because they've been chronically homeless, they have medication, and they're not taking their medication. So the first thing we want to do is to get them into a location whereas they can have their medication administered for them, so they can have those reminders. And that's our safe haven, which has a psychiatrist on site. We have a nurse practitioner, there's a clinical supervisor, there's a recreation specialist, and then there's a housing specialist that can work with that person towards their housing needs. Next slide. to outreach and housing placement. Again, we're operated and available 24 hours, 7 days a week. That is our phone number there, 347-538-2314. And then also we have the drop-in number there as well, because we can be reached there, because we work together. Next slide. Hope count. How people can help. Every year, during January, thousands of volunteers across the 5 boroughs participate in the annual homeless outreach population estimate. And this is an estimate. So this night, a group of volunteers go out and they canvass the whole entire Staten Island, the parks, the public spaces, Parks Department, NYPD involved with this whole with the Hope count to ensure that we're counting everyone. And it's required. It's required by the U.S. Department of Housing and Urban Development, which is HUD. And it's a prerequisite for funding for everyone. Next slide. Stigmas. There's a lot of stigmas with homelessness. And homelessness can be confusing. It can be confusing to those who don't understand it or believe that people don't choose to be homeless. You know, often homeless individuals are attached, you know, to these type of stigmas, saying that they're dirty, they lack morals, you know, they're a burden on society, they're being called lazy, being called addicts, being called crazy, you know, and stating that they choose to be homeless and, you know, that they can do better, that, you know, so many things that they can do. But people do not choose to be homeless. They do not. I've never met an individual, and I meet every single one of them that come across our program, and I've never heard them say that they wanted to be homeless. You know, homelessness is real, and it can happen to anyone, you know. And most people that are homeless are depressed because they're depressed about being homeless, you know, and they're not happy about their current situation, so they're not wanting to be this way, and they're looking for help, and a lot of them just don't know how to get help, you know. Next slide. That's it. For more information about us, please, you can contact me at 718-727-2515. Thank you.
Thanks so much, Tisha. That was amazing. It was really interesting to learn a little bit more about the stigmas that are attached to people who are homeless and what their own concept of themselves being homeless is. And I also really appreciated learning the difference between encampments, pop-ups, etc. You know, I've heard at different Project Hospitality functions that there are lots of groups of homeless individuals living in places that I had never even imagined they could live, in the woods, right down the block from where I grew up, or in a cemetery, you know. And then also we learned a lot about the working homeless on Staten Island, which nobody covered yet, but I think I just want to point out that a lot of people, because of the unaffordability of living here, a lot of people who have jobs can be seen, you know, walking out of the woods across Staten Island on their way to work, and they don't have a shelter, they don't have a place to live. Yeah, so I encourage you all, if this is bothering you or you're concerned about how to make an impact in this, that we start talking to our legislators, we start looking into policies, and we really come together to advocate to reverse some of those trends that people find themselves in, becoming homeless in the first place. So for our last and final presentation, I'm going to introduce Tabitha from Project Hospitality. She oversees their youth services, and she's going to highlight the different resources that are available for children, for youth who are experiencing housing insecurity. So Tabitha, we're gonna just unmute you, and you can take it away. Thanks so much.
Hi, I'm Tabitha. I'm the program director of Project Hospitality's Youth Drop-In Center. We are a 24-hour site that serves at-risk youth from the ages of 14 to 24. Our main focus is on runaway and homeless youth. We're located at 27 Port Richmond Avenue, which is right at the corner of Port Richmond Avenue and Richmond Terrace. I'm going to be talking about Project Hospitality's youth services and the programs that make up this division. So who are runaway and homeless youth? They are youth and young adults who are living on the streets or do not have a stable place to live. They are often trying to escape neglect, abuse, conflict in their homes, forced work, sexual exploitation, and intolerance of their sexual orientation or gender identity. Next slide. So homeless youth could be youth that are sleeping at a friend's house or couch surfing. They could be riding the subway or staying on the street. They could be trading work or sex for a place to stay or other needed resources, living in a car, sleeping in parks, abandoned buildings, or other public places, staying in a crisis shelter or transitional shelter, staying at someone else's NYCHA or supportive housing apartment, even though they're not allowed to be there. They also could have been forced to leave their home with no place to go. A huge proportion of the runaway and homeless youth are LGBTQ identified, which some studies estimate that up to 40% of runaway and homeless youth are LGBTQ identified. Next slide. Next slide. Thank you. Stability in youth's lives is critical for their ability to thrive and be successful. Unfortunately, many youth experience homelessness or housing instability due to a variety of reasons. Due to the nature of youth instability, it can sometimes be difficult to pinpoint those who are most vulnerable. Each year, New York City conducts a point-in-time count of shelter and unsheltered homeless adults, families, and youth. This is called the Hope Count, which was mentioned in Tisha's slides. For the past 3 years, New York City agencies, runaway and homeless youth providers, and advocates have collaborated to improve the methodologies to be able to better account for homeless youth. The youth count is developed through this initiative, which catches youth who were not counted with their families in shelters or found in common spaces such as subways, on the street, or abandoned buildings. The youth count occurs usually around the same time as the Hope Count. Next slide. So from the youth count in 2018, they found that there were a little over 7,000 youth who were sheltered but considered homeless, and there were 220 youth who were unsheltered. The demographics of these youth include about 70% male, 24% female, and 6% transgender female. The race is split between Black or African Americans and Hispanic and Latinos. Makes up about 9% white and 9% multiple races and 9% other. The sexual orientation is generally straight. 16% are gay or lesbian, 6% are bisexual, and 6% identify as other or have not identified. The ages there were 8% under 18, 31% from 18 to 21 years old, and a larger proportion of 21 to 24-year-olds. And a lot of that has to do with not as many housing programs that are geared toward 21 to 24-year-olds. Next slide. Runaway and homeless youth services are designed to protect homeless youth and reunite them with their families whenever possible. We also fund specialized programming for runaway and homeless young people who are pregnant, parenting, sexually exploited, lesbian, gay, bisexual, transgender, and questioning youth. We are committed to providing funding for a variety of services in order that all runaway and homeless young people will have access to the resources they need to get off the streets and stabilize their lives. We're also funded by the New York City Department of Youth and Community Development, which funds drop-in centers, crisis service programs, transitional independent living programs, and street outreach, and referral services. Next slide. So, I'm sorry. The Project Hospitality's Youth Drop-In Center, we serve youth 14 to 24. We serve as a hub and entry point for our TIL housing programs and other referrals. The Youth Drop-In Center provides a range of direct services to youth between the ages of 14 to 24. Services include, but are not limited to, crisis intervention, assessments, food, clothing, case management, counseling, mental health services, housing referrals, restrooms, employment assistance, and access to computers. Our transitional to independent living centers provide homeless youth between the ages of 16 and 21 with support and shelter as they work to establish an independent life. All TIL programs are open 24 hours a day, 365 days a week. There's also another branch that's called Crisis Shelters. Currently, we don't have any on Staten Island, but they serve youth from 16 to 20 who don't have a stable housing, and they may get a referral to crisis services program first, and they would receive it through our Youth Drop-In Center. Next slide. So the Youth Drop-In Centers are primarily established to meet the basic needs of homeless and runaway youth and provide a safe space for youth to retreat to. Youth are able to come get something to eat, use our showers, utilize computers for communication and/or job applications, a place to store some of their most important belongings, such as identity documents, clothes, and other stuff. We also have reclining chairs, which allow the youth to have a place to rest with their feet up while waiting for housing placements or referrals. The secondary needs for the youth are addressed through case management. Case management staff provides youth with information and referrals for vocational and educational programs, public assistance programs, mental health referrals, and workshops that address daily living skills such as budgeting, interviewing, and resume building. So the youth, also, I just got a message from Selena, the youth who, we're not a shelter, so we're a drop-in center. So the youth aren't able to necessarily sleep at the drop-in center. We don't have beds, but they are able to rest in the chairs and take a nap or just close their eyes. Next slide. So our staffing includes case management staff, youth workers, social workers, and a psychiatric nurse practitioner. We also have a mental health therapist come to the site once a week as well, and the nurse practitioner comes to the site once a week as well. Additionally, if a youth has an Access 1 diagnosis, they may be deemed eligible for supportive housing. To be able to submit and complete a supportive housing application, they'll need a comprehensive psychiatric evaluation to submit with it. Also, our training, staff training, they're required about 40 hours of training per year, which is agency protocol and also funder protocol. These trainings can include trauma-informed care, LGBTQ gender inclusive, professional development, housing referrals, skills on de-escalation, CPR, first aid, Narcan, mental health first aid, and more. Next slide. So our youth drop-in center is made up of two programs, a day program and an emergency overnight program. So the day program starts at about 9 a.m. Till 12 a.m. During this time, anyone can come from 14 to 24. They can utilize our computers, attend our workshops, relax, socialize. They also have access to counseling, internet access, education, job training, and creative arts activities. They can also do laundry or use the showers. Our emergency overnight program is for youth who are 18 to 24. It provides an overnight respite and chairs for transient youth while assisting youth with attaining stable housing. Youth 18 to 21 are typically referred to crisis centers or TIL programs depending on their level of care needed. Youth to 21 to 24 are provided with case management services to assist them with accessing a variety of services to assist with housing. And they're more difficult to place. It takes a little bit longer to get them into housing because it can include them needing to get an income or applying for a housing voucher. So it takes a little bit longer for them to get direct shelter. Next slide. So when you become a youth drop-in center youth, you do an intake. Anyone can walk in at any time. They sit with the youth worker or case management to complete an intake assessment, and from admission, they complete a service plan. After their intake, they are assigned to a case management staff. The case management staff will identify different resources available that will help them achieve their goals, such as housing, financial, or emotional stability. If deemed appropriate, the youth is also referred for mental health services, either with our social work staff or a therapist for psychosocial evaluation. And depending on the psychosocial assessment, the youth may be referred to a psychiatric nurse practitioner or to an outside referral for mental health services. After intake, the case manager will conduct a comprehensive, in-depth skills and needs assessment. They will develop an individualized service plan with the participant within 30 days of admission. They will also be responsible for providing the referrals for housing and other things that may create barriers for the clients to reach their goals. Next slide. Okay. So then usually if the youth is from 18 to 21, they'll be referred to our transitional to independent living program if there's an open bed. They'll be screened by their staff over there. They will be intaked. Usually they share a bedroom with, I believe, 2 to 3 other youth. They also have case management staff, social work staff, and mental health services. Usually during the day, they aren't allowed to stay in the transitional to independent living. And a lot of times they will come to the youth drop-in center for our day program. Next. So Project Hospitality has 4 TIL programs throughout Staten Island. There's about 40 beds in total, 35 male beds and 5 female beds. There's 6 scattered site units spread throughout Staten Island. Each TIL has bedrooms, a kitchen, common area, and clinical staff located on site. Depending on the independence level of the youth and availability, they can either be placed in a shared bedroom or in their own bedroom. One TIL program is reserved for youth between the ages of 21 to 24 years old with a total of 10 beds. It's not open yet, but it will be opening soon. Next slide. So I want to share a success story. The success story, the client grew up in the Dominican Republic with her biological mother and her mother's family until the age of 9. Because of issues resulting from conflict with her family, she ended up having to move to the United States, and her stepmother kicked her out. The client was a junior in high school and also reported that she was an honor roll student. Also reported that she was an honor roll student. And the client, she had to drop out of school in order to work and save money. So after entering the TIL program, the client was very proactive in finding a place to live and was also proactive in finding a job. she became a manager of McDonald's, and despite the long commute and work each way, she got up and went to work every day. The client ended up also getting her, she got promoted to manager at McDonald's and stated that her intention was to grow the company. She has a strong sense of confidence and is willing to utilize services that the TIL provides. She has worked with the case manager and the social worker to learn about money management, time management, hygiene, education, and career services. She is very humble and also willing to work on herself so she can continue to flourish. She is very willing to meet with the case manager and social worker to achieve as many of her goals as possible. And next slide. The final slide is what we hand out to youth or people who are looking to refer youth. The first one is all the drop-in centers located in New York City. Manhattan, the California Center is a 24-hour site. Brooklyn, SEO Family of Services. That's not the correct address anymore. They just changed location, so you'd have to search it, or you can contact me for the location. Queens, Sheltering Arms has a 24-hour location, and the Bronx, Cardinal McCloskey. And then the other ones are day program youth drop-in centers. On the other side, it discusses crisis services and TIL programs, which include Covenant House. It's for youth under 21 years old. They also have programs throughout the United States. Safe Horizon, Streetworks, which is in Harlem, Sheltering Arms, Safe Space, Ellie Forney, and Children's Village. And those all serve from 16 to 21. And then there's also a street outreach team that you can contact from 7 p.m. to 2 a.m. 7 days per week if needed, or use DYCD Youth Connect. And if you need to contact me, my email address is there. You can also call the number if needed. And any youth can walk into our site 24 hours a day. And that's it. Thank you so much for listening.
Thanks so much, Tabitha. That was really very helpful. If you want to send me the information on the last slide as a flyer, we could email it out to all of the attendees. So I'm just going to wrap us up here and make brief mention of a couple of places that our presenters mentioned today, but I wanted to give you the address so you can contact. The PATH is in the Bronx. It's called Prevention Assistance and Temporary Housing Office. The PATH Center is for families with children and pregnant women. So like Tisha mentioned, the Project Hospitality Drop-In Center would not be able to take families with children or a woman who is pregnant, so they would have to be transported to the PATH. Project Hospitality can help with transportation to get up there. I have tried many times to get in touch with a person from the PATH. I don't have those connections. What it says is call 311. 311 gives you this information that the person needs to take public transportation or be transported up to the PATH Center. That's where they get screened and enrolled into other shelter systems and potentially placed back on Staten Island or in another borough. There's also the New York City Adult Family Intake Center, and this is for families without children. There's the address. We have information on that. And then I wanted to just make note, thanks Tabitha for mentioning this, but if you're dealing with an LGBTQ person, they might not want to go into the traditional shelter system. These are two locations that could help place youth and LGBT adults. It's the Allie Forney Center or the Marsha House. And we can certainly share those locations with you as well. Okay, so now we're going to take questions. We had a few questions come in, a few more are coming in now.
There's one from Megan.
Oh yeah, Megan. So go ahead, Sadia.
Yep. So the question from Megan from Chancey was, where are some of the places you refer clients if they're not eligible for home home-based services. And the question was from Gracie from Canva.
So, Reen, can we unmute Grace from Canva to answer that question for us? Where are some of the places you refer clients to if they're not eligible for home base?
Can you keep getting cut off at just that question, the beginning part of the question?
Oh, so where are some of the places you refer clients to if they're not eligible for the home base service?
So where do we refer them to? It depends on what the client addresses their needs are. For example, if we can't help find apartments in Staten Island unless they are at risk for shelter entry. So we could provide them with a list of brokers it's right in our office when any tenants come in as a walk-in. It's a list of brokers and ways to find an apartment and resources so that the tenants can help themselves into looking. And once they do find the apartment, they could try to see what they're eligible, if they might be eligible for home-based services. If they're not eligible for services, we're going to find out then why. And then it might have to be that they have to go back to HRA because they haven't done the full array of trying to access the application or applying for a subsidy. It varies from case by case. So it could be just referral to another organization in which we have partnered with that might be able to help with financial assistance, but they require for the individual or household to pay back. So it depends if they're not eligible for services, but we try to at least leave them and give them meaningful referrals and have them still stay in touch with us. Just because they weren't eligible now doesn't mean that they wouldn't be eligible maybe the following year or even months later, because our eligibility requirements change every year as well. Not to mention also the federal poverty levels change and the area median income changes.
Okay. All right. So in order to share that question your answer, we're going to ask you I'll send it to you via email. We'll get it and then we'll send it out as an FAQ. But we did have another question for you.
That's from Serena from SAUH. Can home-based assist an individual or family with a pet?
So I was viewing that question. So again, with a pet, I kind of was trying to find out in which way, because it could be that if they have a pet and they're moving, let's say they're moving to another apartment, you have to definitely find out if that pet, if the landlord accepts you to have a pet. That's one. If you have like a pet and you're experiencing a housing crisis, that doesn't really, it doesn't mean if you're not eligible or eligible for home-based services. So it's, you could have a pet, but if you're getting evicted because of having a pet and you broke your lease, we're going to have to look into that or find out if that was actual on the lease. But if you're moving into an apartment and they're telling you no pets, then you have to abide by what it says on your lease. But also, in addition, I'm looking into the aspect of if this pet is for assistance for the individual, just provide documentation then for that as well, too.
Okay, great. Thanks so much, Grace.
No problem.
Oh, yeah. Okay. So I actually had a question for Tisha. So, Reen, we could unmute Tisha and mute Grace. My question was when you were talking about the encampments that you found by Snug Harbor. So if it's a structure that somebody built as their shelter, is it illegal? And what's the harm in leaving it? Like, why did your team have to remove it?
It is illegal, and 9 times out of 10 it's on someone's property, either the city, the state, or it's on someone else's property. So those owners are contacted, and then the owners also agree upon that they would like the stuff to be removed. But before we remove anything, we contact the clients, we let them know, we give them letters. We offer them, place to stay. We do everything that we possibly can to inform them so that they know that we're coming to take away the stuff because it's on private property. Let's say, for instance, the Staten Island ballpark. We have a lot of individuals that were there that we had to have removed because they had their stuff affixed to their property. And again, they'll get letters, they'll get notified. that is going to be removed on what day, so that they can take their belongings and that they could, either come in and accept services, or they'll normally go to another location, to be honest. That's what would happen. And then we'll find them, and then we'll start all over again.
Great. Thanks, Tisha, so much. I have a question, and perhaps, Tisha, if you want to stay on, you could answer this. Are there any women's shelters available on Staten Island?
No. There's no shelters on Staten Island, let's be clear. There are absolutely no shelters on Staten Island. Again, there are shelters that are in the process of being built, but there are no shelters on Staten Island. The family shelter that Project Hospitality do operate is operated through our Department of Homeless Services, so we don't dictate who goes to that. So if you're in Staten Island and it's a family, they become homeless, and they show up at the drop-in center door, the first thing we got to do is to sit on the path. Even though they're from Staten Island, does not give them the spot to be on Staten Island. Let's just say, all right, they went to PATH, and when they get to PATH and they say, I'm from Staten Island and I don't want to leave Staten Island, for them to be diverted to this shelter, it's not possible. It depends on what beds are available. So it's a vacancy process. Wherever there's a bed available for that family, that's where that family is going for that night.
Okay. Just to follow up on that, do we have any idea of when those two shelters that are supposedly coming to Staten Island are going to be open?
The last thing that I heard, that they were, at first they were fighting against it, and then the community lost that fight. And then I know that they were going to do it, I think, in the next year. They're going to be breaking ground soon, but it's going to be up in about another year.
Okay. The next question is transportation from the drop-in center to the PATH center always available?
No. I wanted to touch on that. So that, in terms of transportation from the drop-in center to PATH, that is on a case-by-case basis. So my team, drop-in center staff are fixed to the location. Outreach staff are not. They canvass, they drive around, we have vehicles. However, we are not, in the business of just transporting folks off the island, because we canvass Staten Island. So what would happen is their family that came to the drop-in center, there was a mom with 4 children. The children was from newborn up into the age of 4. So we couldn't allow that woman to take that family, to go on a train. That's a long ride up to the Bronx. First time being homeless, was very scared, didn't know what was going on. So of course, I approved, take them, that we'll transport them. 9 times out of 10, we'll give a Metro card, to someone anyone that we give a referral to, we're going to give a Metro card to. But it is a case-by-case basis for transportation. Someone that has mobility issues, we would transport. Someone that has some mental health issues that we know that we need to refer them off of Staten Island into an assessment shelter, we would drive them directly there as well. So it's definitely on a case-by-case basis.
Okay. And then we had one other question from Christine, and it is, I don't know who to address this to. I work in the ER, and I get many patients that have vouchers but cannot find housing. Is there help with this, and who would help them? Who would help clients with this?
When you say they have vouchers, so if a person have a voucher, they could have a Section 8 voucher because their apartment was deemed unsafe, and Section 8 gave them a voucher so that they could find an apartment. But anyone that has a voucher, there's criteria to getting those vouchers. So they at one point in time, where they receive that voucher from. So for us, if I'm working with an individual and they've been with us over 90 days and they're in my system and they receive a voucher, we're working diligently with them and a broker, housing specialist to find housing for them and to educate, the landlords in terms of how the voucher works. But people just showing up to the emergency room or in the hospital and they're saying that they have these vouchers, I would like to dig a little deeper into how did they obtain those vouchers, because if you got that voucher, that's the same place you should be going to to get some assistance in terms of helping with their voucher. Because the voucher expires the voucher is generated every quarter. So let's just say that voucher was generated and that person have the voucher. If they don't have a public assistance case and nothing's active, that voucher is dead. To technically say that, but it is. It's just not working. We've had individuals that had came off the street and they had vouchers, and we try to work with them and come to find out that the vouchers was expired because they did not have an open PA case. The SSI wasn't pending, and they didn't have any other income. So there's a lot of things tied behind that voucher. So it's not like they're just waving, having a bunch of vouchers and can't use it. There's more behind it.
Okay. All right. So just in the interest of thanks, Tisha. Sorry about that. So, just in the interest of everybody's time, because I see a lot of people are logging off. If somebody needs help applying for a housing voucher or rental assistance, is it safe to say, Tisha, that we can connect people with your outreach team?
So if they have a voucher and they're looking for, I'm sorry, what was the question again?
How do we apply for a voucher?
So in terms of applying, and I keep hearing that word, it's not possible to apply for a voucher. You have to be in a city shelter system. You have to be in a city shelter system, and it used to be for 1 year. So we fought to change that. So it's 90 days. So if you're in the drop-in center or you're connected to outreach or you're in a city shelter, you have to stay there for 90 days in order for them to get a voucher, for them to generate a voucher for you. And just think about that 90 days because you're working with them, right?
Yeah. Okay, that makes sense. So everything starts in the shelter system. Okay. We're gonna follow up with some of these questions with the presenters, and we'll send out an FAQ to all the attendees. I did see somebody ask if we'll be sharing the slides as a recorded webinar, and that'll be on our website. So you'll all get a notification on that. But I do want to take the time to thank all of our presenters. Again, thanks so much for bearing with us, everybody else that's on the webinar. We hope that you found this interesting and informative. And if you have any other questions, please shoot me an email, and we'll be able to address them with you after we wrap up. Okay, thanks so much, everybody. Have a great one.